Today, July 11th, is World Benzodiazepine Awareness Day. This might not sound like that big of a deal, but the dangers of benzodiazepines are a real and hidden health crisis that's been overlooked for far too long. Benzodiazepines, or more commonly called benzos, include drugs like Xanax, Ativan, Klonopin, and Valium. They're usually prescribed for things like anxiety, panic attacks, insomnia, and even muscle spasms. Medical providers typically prescribe them quickly and carelessly, sometimes without explaining the risks to patients at all. But here's what many people, including medical professionals, don't fully understand. These drugs were never meant to be used for more than a couple of weeks. However, millions of people are prescribed them for months, years, or even decades. And the dangers of these go far beyond addiction. Benzodiazepines work by slowing down the central nervous system, creating a calming effect at first. But within just a few weeks, the body develops a physical dependence to the drug, even if it is taken exactly as prescribed. Once dependence sets in, stopping these medications can trigger severe and life-threatening withdrawal symptoms, some of which can last for months or even years. This isn't just discomfort we're talking about. This is a serious medical and neurological injury. And this isn't addiction. This is physical dependence that most patients were never even warned about. While there are over 200 symptoms that can arise from these medications, some of the most commonly talked about are anxiety and panic attacks. These are often far worse than the anxiety and panic users report experiencing prior to their benzo use. Insomnia and sleep disturbances, which can last weeks, months, or even longer. Intrusive and obsessive thoughts. These racing, scary, and unwanted thoughts typically revolve around fear, death, or health, and suicidal ideations often accompany them. Other symptoms can include sensory sensitivities, muscle pain and tremors, depression and emotional blunting, dizziness or vertigo, cognitive impairment, gastrointestinal issues, heart palpitations and POTS-like symptoms, depersonalization and derealization, and the risk of seizures and even death with rapid tapers and cold turkeys, which are often doctor-led. Many people experiencing symptoms end up being misdiagnosed by their own providers. Instead of recognizing these symptoms as benzo withdrawal, doctors label them as a return of their anxiety or depression, or even insist a new mental illness is present or another diagnosis. This leads to more prescriptions or unnecessary hospitalizations and creates a devastating cycle of misdiagnosis, polydrugging, and further harm. So who are the most at risk? Well, elderly adults are often prescribed benzos for sleep or anxiety. But along with the other symptoms, they are much more prone to falls, confusion, memory loss, and other cognitive decline. These symptoms are often dismissed as just old age. Women are much more likely to be prescribed these medications than men for situations like anxiety and insomnia, and their concerns are often more dismissed than those of men too. People with trauma or PTSD are given benzodiazepines for relief from panic and emotional pain. Even college students and young adults are being prescribed benzos for test anxiety, social situations, and sleep problems. But the truth is, anyone can be at risk. This is not a rare or isolated issue. In the US alone, over 90 million benzodiazepine prescriptions are filled each year. That's almost 250,000 prescriptions filled each day. Yet, unlike opioids, this crisis has not sparked widespread public attention. Why is that? Because many of the people affected never misused their medications. They were taking them exactly as prescribed. They weren't seeking a high. They were simply following their doctor's orders. So what can we do about this? First, we need awareness. We must educate patients, families, and doctors about the real risks behind benzodiazepines and about safer approaches to tapering. No one should begin these medications without being fully informed of the very severe dangers. Second, we need compassion. People suffering from benzodiazepine withdrawal are not addicts, and they are not going crazy. They are patients who were failed by the medical system, and many now feel trapped, alone, and abandoned. They need understanding, validation, and support, not judgment. And finally, we need advocacy. This crisis will not be solved in silence. We need to push for better medical education for providers about benzodiazepine prescribing and tapering methods. We need stronger prescribing guidelines that prevent unnecessary long-term use. We need research funding into benzodiazepine withdrawal and injury, and support networks for those suffering, including online resources, local groups, and peer support. We can also write letters to medical boards, share our stories, and talk openly about these issues. Every time we speak up, we help protect someone else from falling into the same trap. Benzodiazepine injury is real, but hope is real too. The more we speak out, the more lives we can save. For more information, please visit the following resources.